One of the questions that a lot of doctors ask me when I train them on ANS equipment is, so I get all this data, what do I do with it? Well, first of all, the data is there in order for you to do a few things with it. Number one, when you sit down with a patient and you show them a graph, and you show a patient that they have, for example, small fiber neuropathy, or they have loss of cardiac variability, you get a much more motivated patient if you're trying to control the blood pressure, the diabetes, or weight loss. In my case, which is what I do a lot of, I just get a more motivated patient. I know when the patient walks out the door here, they know they got a disease process that has begun, and if they want to stop it, they got to do X, Y, and Z that I've told them in order to do it. So you get a much more motivated patient. You also, when you have this data, you can be more aggressive. So if you had a patient who had a hemoglobin A1C of 7.6, and maybe you weren't that aggressive with them at that point because you were really waiting for it to get to 9, for example, which I see a lot, you would be a lot better off getting more aggressive with them, either treating them with weight loss, metformin, a GLP-2, or whatever treatment that you feel more appropriate. But you will have the right data in order to get more aggressive, to get maybe those more expensive drugs covered by the insurance company, as well as decreasing the amount of sugar per day the patient is eating to very, very low levels, which I believe should be in the range of 30 or so. Also, if you have a patient of elevated cholesterol, so on and so forth, you're a lot more motivated, and the patient is a lot more motivated to use the means that you both decide, be it statins if you use statins, be it fish oil if you use fish oil, or flaxseed oil if the patient is allergic to fish, as well as other modalities. Also, there's some supplements that can help, for example, with small fiber neuropathy. For example, we have a line of supplements called Slate Medical Labs. We have a whole program that we do with it, so we can take these patients and start giving them fish oil supplement or flaxseed supplement. We can give them CoQ10 if they're not taking CoQ10. We can give them stuff that will help them feel better, increase the amount of fiber in their diet, and decrease the amount of sugar in their diet. By taking these actions, you're able to get a better patient outcome. Finally, you can also repeat this test in about 6 months. I don't like to do the test more than twice a year. I know there's some places doing it 3 times a year. I think it's overkill, and there are problems with reimbursement when you do it more than twice a year. But if you do it twice a year, you can actually see how the disease has either stopped progressing or is continuing to progress, and will give you a very good idea as to how the patient is doing in terms of control. One of the other things that I see a lot is you'll get a young, healthy patient who comes here who has a normal test. Well, that's great because that gives you assurance that this patient has a normal test and they're good for at least another year or two. And this is a patient who may have a hemoglobin A1C of 6.1 that you've been worried about. Maybe they're 30 pounds overweight. So you can simply say, look, your test is good. You're not showing any neuropathy. Things are not starting, but why don't we start early and do some weight loss and do some glucose medication in order to get you not in the disease process in a bunch of years. Also, the reverse is true, where you'll get a young patient who begins to show at the age of 30 small fiber neuropathy. Well, those patients, you need to get very aggressive with, because that those are the patients that progress to severe disease by the time they reach the age of 50 and 60. So by repeating the test and doing the test on patients that are young but have the disease processes that you need, you can take it from there. Another major reason to do the test is, for example, back pain is an indication, limb pain is an indication. Well, you may have patients who are coming to you complaining of back pain, and everybody thinks that they have, we can't find a herniated disc. But guess what? They have neuropathy. They're having back pain because they have neuropathy. And if you don't deal with the neuropathy, you will not be able to improve their back pain. So this equipment gives you all this data. And those are just a few of the examples of how useful this equipment can be. There's a lot more. Thank you again.
One